10 years, it's a very sad anniversary that we would rather not live through. We were hoping that by now the situation for the people in Syria would have improved considerably and that we wouldn't be talking about such huge numbers of refugees living in neighboring countries or spread all over the world, and especially not see the misery of those people who have been internally displaced. Our assistance in Northwest Syria is focusing on those vulnerable people. We're talking about a huge number of children and women living in the desperate situation of not having a fixed home, but living in temporary shelters, living in big camp situations, which create an unbearable humanitarian situation. The situation is extremely strained, with a huge population being completely dependent of humanitarian assistance. The crisis is further exacerbated not just by the war situation, but by the disastrous economy that whole of Syria is facing, with a devaluation of the local currency, with food prices going up, with the crisis in neighboring countries like Lebanon has a huge impact on the ability of the people inside Syria to cope with the situation. The situation was desperate and problematic before the onset of COVID-19. Now, with the pandemic, the situation has grown worse, and especially our medical staff is under huge pressure as worldwide. But in Syria, you have to imagine that the people are working under conditions which don't allow a normal hospital routine, which don't allow normal standard hygiene protocols. Everything is a bit makeshift, and now they had to adapt to a situation where they were fearing the spread of the disease and where they have people in living conditions that don't allow social distancing easily. So we have been trying to support them as best as possible, providing them with protection material, trying to ease the burden on the facilities by providing oxygen generators in order to treat COVID-19 patients or help them not to develop serious symptoms. What we've been doing from the beginning, and that hasn't changed over time, is trying to save lives. We're working with our partners in the medical sector in order to keep a health system up and running that doesn't get other support than fragmented assistance from non-governmental organizations. We try to coordinate our assistance as best as possible. We run mobile clinics, we run primary health care centers, and we massively support the secondary health care, saying hospitals and facilities that are specialized in mother-child health care.